Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. When you're enrolled in a dental hygiene program, you will be involved in an IPE, an interprofessional experience. Ooh, doesn't that sound exciting? So what is an interprofessional experience? Well, the Code of Standards require an interprofessional experience before you graduate, where you collaborate with a member from a different discipline, say nursing students or rad tech students or early childhood education students, and you learn about how they do assessments on patients and how it differs from you and what their body of knowledge is versus your body of knowledge so that you can find a way to put yourself together like a puzzle as different parts of a team that treat an entire patient. Have you ever seen the size of medical books? Oh my goodness, they're huge. There's such a vast amount of information that there is to know about a patient. So the idea behind interprofessional collaboration is that each discipline or member of a collaborative team has a body of knowledge and a depth of understanding about a specific area or discipline that works with a patient. All of those different disciplines together make up a really big, strong pool of knowledge. It's like getting a bunch of smart people in a room together to discuss the needs and treatments and ideal care for a patient. Imagine what you can do when you put your heads together. So, an interprofessional experience when you're enrolled in a dental hygiene program provides you with the opportunity to look through the lens of another professional, to teach them a little bit about your discipline, to learn a little bit about their discipline, and to take something away and figure out how to incorporate that into a resource for your future. As you work through the program, you will learn about your discipline and you will become an expert in your discipline. Through the collaboration with others, you will learn about how to reach out to other disciplines to benefit and meet the needs of your patient. You will also learn how to become a good member of a dental team and a good member of a collaborative interprofessional team. So that's what this podcast is about. We're going to talk about interprofessional collaboration. Hey, if you're in hygiene school or just got your acceptance letter to hygiene school, I've got a new course to help set you straight right out of the gate when you first start your program to help ensure a successful transition from the first semester to the second semester and to the finish line. I will help you strategize all the key strategies that you need, understand what the challenges are, and overcome all the obstacles. Learning in dental hygiene school is different than any other program. You've got a lot of assessments that are evaluation style. You need to be able to plan and prepare for that and be successful so that you can become an RDH. And I'm here to do that for you. I have a new course, How to Be a Successful Dental Hygiene Student. You can click the link right in the show notes and I'll show you how to get it done. Congratulations on entering this profession. Now, as part of our accredited education, dental hygiene students learn all about value-based approaches to the healthcare needs within their community. Students learn about policy development, program planning, and the types of approaches that are required in order to make the connection between oral health and overall health. It has taken decades to bring together a model that brings care to people using dental and medical integration, and we are making some progress. With a lens on collaborative interprofessional work, healthcare professionals can move forward in a way together, sharing the data, the evidence-based research, the clinical practices, and the models that help them collaborate to provide comprehensive care in an equitable way. Now, lack of connected and collaborative care really affects how and if services are provided, as well as where patients can access care. So I would define it as kind of clunky with some missing parts. There's a large gap in coverage for many Americans, even with the passage and implementation of the Affordable Care Act. There's still gaps in coverage. That being said, the coverage excludes dental with the exception of Medicaid expansion. Every state has their own variability on what the coverage includes, and dental emergencies for adults without coverage falls on the shoulders of the emergency rooms and local hospitals for the most part. In an accredited dental hygiene programs, students are required to participate in an IPE, an interprofessional experience. And this is defined as an event that happens when two students from different disciplines collaborate together to improve the health outcomes of an individual or a group within the community. The idea is that there'll be improved oral health and collaboration between the different disciplines, and that the care is more comprehensive, sustainable, efficient, effective, and mitigates oral health disparities. The shift to interprofessional collaboration was initiated by several factors: the passage of the Affordable Care Act, the evolving nature of dental hygiene workforce models, and the evolution of the need for collaboration between dental providers and other healthcare workers when they were working with patients with chronic diseases or complex medical histories. So, some of the need for interprofessional collaboration is a natural tendency, and some of it has been brought on by the needs. I am so excited at the prospect of knowing that students all around the country are learning how to approach patient care with a team based collaborative model. It's really the only way that we can move forward in healthcare to be able to truly meet all of the healthcare needs of our patients. I want you to consider a patient's perception or experience as it relates to a clinician who leads an appointment with a team-based approach to care. The dental hygienist supports the efforts that are put forth by the physician by doing things like taking a patient's blood pressure and vital signs, by monitoring glucose levels, providing nutritional counseling, doing screenings for cancer, and providing tobacco cessation using behavior change models. At the same time, if this patient goes to the physician and is asked about their last dental visit, and the physician discusses the importance of preventive services as it relates to their chronic illnesses, their oral health outcomes associated with a medication that the physician may have prescribed, such as a high blood pressure medication. If this medication causes xerostomia or dry mouth, the physician talks to the patient about their increased caries risk. They let it be known that it's important for the patient to tell their dental care provider that they're taking that medication, and they can, at that visit, recommend supportive interventions to care for their dental needs. So there's a collaborative discussion going on for this patient, whether they're in the dental office or at the physician's office. The collaborative care to treat the individual patient based on all of the needs of that patient, as well as how things correlate to one another. It's a beautiful thing. Think about how the patient will feel. They will feel cared for, and I believe that they'll be more satisfied with the care that they receive. The collaboration will be more evident, although the patient may not realize why they feel so cared for. It might not be something that they can articulate. They'll just feel like everyone understands their specific needs. Now, let's define what it means to deliver patient-centered care. Patient-centered care puts the patient in the center of the framework, as the name suggests. As we work through the ADPI process of care, We partner with other healthcare providers to ensure that any of the decisions or the treatments that we provide our patients respect the patient's desires, needs, and preferences, while also providing the patient with the education, interventions, and support that they need in order to be active members. The World Health Organization published a framework for action on interprofessional education and collaborative practices back in 2010. In the introduction to this publication, it states that interprofessional education is an opportunity to not only change the way that we think about educating future healthcare workers, but is an opportunity to step back and reconsider the traditional means of healthcare delivery. What is exciting about this statement is the level of potential, possibility, and promise that comes from the idea of the shift that will happen as a result of this. Our current system can be rejuvenated and revived by providing it with students who can engage across disciplines to meet the needs of the patients in their own communities. What is powerful is that health leaders and health educators see the value in this effort and are aligned to work together in order to implement the type of collaborative workforce strategies and policy creations that are needed in order to meet this challenge. Now think about the framework of collaborative care. There are three different legs to the framework. The disciplinary concepts leg means that your role is to be an expert in your profession and understand all the aspects of your specific role that engages with your patients, centered around all of the pillars of your discipline, your education. An example of this would be your soft tissue management program and your phase 1 therapy. You are an expert in that area of care to patients. Now, the second leg of the framework for interprofessional collaboration is the common competencies for all healthcare providers. Now, this part of the framework centers around interprofessional experiences, and it includes a way of thinking about your discipline and the ways that you engage with the delivery of quality patient-centered care. In this leg of the framework, all healthcare providers tend to have the same qualities for interprofessional collaboration. They take continuing education, continually improve on their discipline. They are lifelong learners, and they remain current in their understanding of the process of care and innovations. The third leg of the framework comes as the ability to communicate and work well with others. This is your team building leg, to be a good member of a team. And this is the part of the framework where interprofessional and collaborative work come together. So you can see that all three components of the framework must be well managed and supported in order to be the most beneficial at meeting the demands of your role and ultimately meeting the needs of your patient. To be a supportive member of a team, you have to be current and an expert in your specific discipline. You have to have the qualities of a good healthcare provider by staying current in your field, maintaining your continuing education, and continuing to evolve on new strategies and techniques. And then you have to be a great member of a team, a collaborative team member that has good leadership qualities, but also can be reliable as a good teammate with good communication skills and supports. As a student, you are a member of a team from your very first clinical rotation. You will develop team norms in order to provide you with what a cohesive team looks like. You will be asked to agree to specific standards, behaviors, and values within your team. We have you do this because this is a great start when you begin your educational journey to get a glimpse on what it looks like to be a good member of a team. As you develop your understanding of medical histories in the clinical setting and identify risk factors that would initiate contact with medical providers, you will begin your journey on practicing collaborative work with other healthcare providers because you will have to call doctors' offices in order to obtain information. You will be expected to do this in a very professional way. So, this approach starts right at the beginning of your clinical experiences, and you will graduate with the competencies that you need to be confident to not only call doctors' offices, but know what the right questions are to ask and what your behaviors and roles should be when you do that. Part of interprofessional collaboration is to recognize your own limitations and what your scope of knowledge is. This is a really important key because it relates to the understanding of why we need to reach out to others. Others have experience and expertise in different areas of the patient, the whole patient, right? And it's important for us to always be asking the right questions and obtaining information so that we can gain insight on the best way to safely treat our patients in the most effective way. It's impossible for us to understand the complexities of all the different medications, procedures, and surgeries and chronic illnesses that patients have. And we need to be able to rely on others to collaborate with in order to help us provide the right kind of care. Many of our patients have comorbidities that require the involvement of multiple disciplines in order to provide care. You will find out if you reach out to a physician to find out more information about your patient's pacemaker, for example, that you may speak to the medical assistant or the RN and then find out that you need to contact the cardiologist. There are multiple providers that are involved in the treatment needs of patients. And so sometimes you need to make several calls to gather all the information. This is where interprofessional collaboration works well when you understand who to call and what to ask when you do call, and what information is important for you to know and what information is important for you to find out. During your educational journey, you will be exposed to just enough content and just enough information and just enough experiences to provide you with the baseline understanding of what your role is in interprofessional collaboration with other disciplines. One final thing I would just like to share before I end this episode. I was online and there's a forum, Dental Hygiene Life with Andy RDH. And it's a dental hygiene stress relief blog where people can just post things back and forth and provide support to one another in our profession. And I came across this blog that just really moved me, and to me is a great example of what we can do to contribute to patient care as it relates to interprofessional collaboration. So I asked Christy Russell if I could share this that she wrote, and she agreed to it. So I'm just going to read to you what she wrote. I wanted to share an emotional story about an appointment that I had today. Long story short, I had a patient in about a month ago for her 6-month exam and prophy, and during my oral cancer screening, I felt about a nickel-sized lump on the left side of her neck as I was palpating. We talked about it, and she had noticed it just days before, but said she didn't think anything about it, so I figured it was allergies. She didn't think it was worth mentioning. I completed my exam and discussed further how she should see her physician to follow up on it. A few weeks later, she sent me a thank you card in the mail to say how appreciative she was that I found it and encouraged her to see the doctor, as she had a scan and biopsy and was waiting for results. Fast forward to today, and she was in my schedule because she was diagnosed with carcinoma on the left tonsil and needed to be cleared in order to start treatment. When she came in today, the first thing that she did was give me a giant hug and start crying and say thank you to me, that now she has a 90% chance that she will be cured. She will start chemo and radiation next week. I was floored, to say the least. Of course, I had tears in my eyes, and we spent a lot of time talking about how to care for her teeth and gums in the coming months. I'm sharing this because I hope it can inspire some of you hygienists that on the toughest days, dealing with all the stuff that we do, when you want to just walk out of the operatory and not look back, that you may think again. We not only just clean teeth like a lot of people think, but we are so much more than that. We can save lives, and people do appreciate the services that we provide. I believe that because Christy took the time to provide comprehensive care and do an oral cancer screening and then mention that collaborative need to see the physician, she may have saved that patient's life. I hope that story inspires you to see the value in interprofessional collaboration, because it certainly did for me. Thanks for listening today. I hope you are as excited as I am for you to become a member of an interprofessional team. It is so beneficial when you have the support of other disciplines, when you're managing your patients' needs, especially those more complex patients that have a lot of medications or comorbidities. It just feels a lot better when you know you can reach out or someone is just a phone call away to make sure that you are truly meeting the needs of your patient. I really appreciate you listening. Join me next time where we will be discussing the Open Network. Open stands for Oral Health Progress and Equity Network, and this is a national organization where you can be part of a really interprofessional collaborative organization. So I hope you join me to listen to that, all the information that there is to know about Open. I would invite you to ask any questions at all that you need answered. Sometimes questions come up when you're listening to this podcast. If you have a question, most likely someone else has the very same question. I'd be happy to answer it and would probably share it in a future podcast.